So I'm speaking today to the lovely Barbara Scott, who is the chair of the Association of Reproductive Reflexology. She's a reflexologist herself, and she's also the founder of Seren Training. So thank you so much for talking to me. It's lovely as always to speak to you.
Oh, it's such a pleasure to be here, Sarah, and just get the opportunity to chat about what reflexology does and how it can help. And so I get the opportunity to talk about something I'm really passionate about. So it's a pleasure to be here.
Oh, well, thank you. And I think it's really important because it's great to hear about the benefits of reflexology in general, but also in relation to infertility and trying to get pregnant as well, because I don't think people always understand what it is and how helpful it is. And you will do a much better job of explaining that than I will. So do you want to just explain what reflexology is as a starting point, please?
Yeah, it is a good place to start. And what I will say is that reproductive reflexology is a slightly different approach, but reflexology itself has been around for an extraordinarily long time. So it was used in ancient cultures, in Asian cultures mainly. So in places like China and India and Egypt. It was used thousands of years ago. I always, a kind of history says that it was used alongside or as part of acupuncture. So it's been around for, lots of people have heard of acupuncture. And all that happens is that instead of sticking needles in you at little, varying points around your body, we access those means of helping to make people feel better, those kind of healing points, through your feet or your hands or sometimes your ears even. So the principles are, the theories are, that I'm going to talk about feet mainly because I work really only with feet and hands, is that in the kind of soles of your foot and probably, and certainly other parts of your foot, there are these tiny little reflex points which represent each part of your body, each organ of your body, the skeletal structure of your body, the nervous system. And so what we do is manipulate those little points. So it's not massage per se, which people tend to think of it as being a nice foot massage. It does feel nice, but what we're doing is we're working on these tiny, very particular little reflex points to encourage change, to encourage the body to heal itself, to take care of itself and start functioning as it should do. And so reflexology per se, that is how that works. And the interesting thing about it now is that there are now lots and lots of pieces of research that shows that it is having an effect. So one of the things I always say to people is that we can't always explain how it works, but what we now have is evidence that it does work. So there have been quite a lot of studies now in terms of reproductive health, particularly with relation to women. So looking at things like and endometriosis, and looking at things like PCOS, and looking at managing pain. And there are now pieces of research that show outcomes that reflexology does have a benefit in those areas.
Right.
So yeah,
specific conditions, but also just in general well-being and feeling better as well.
Yeah, so one of the things that we're absolutely allowed to say is that it's good at managing stress, because it instigates a response that is measurable. So you can kind of measure cortisol levels before and after, and you can see, and you can measure things like heart rate and blood pressure, and you can see that those things might be slightly elevated beforehand, and then you'll have a treatment and they're lower afterwards. So there is also evidence to say that, yeah, it makes you feel better, it makes you feel good. And one of the things I say in terms of reproductive reflexology is that if you have somebody who is very stressed, what our body does is the first thing it will ditch is reproduction, because it's not important. what's important is keeping all our vital organs working effectively. So reproduction is the first thing that tends to be affected. And so even if all we're doing is managing stress levels, that in itself is going to start having a positive effect on reproductive conditions for both men and women, because we're really passionate about working with men.
Yeah, and also there's a lot of research that shows that our reactions to stress will lead to things like stopping treatment or not starting treatment because we're worrying about it. So reducing stress generally, and all the things that our stress reactions, overeating, drinking alcohol, smoking, those sorts of things are all harmful to our ability to conceive as well, aren't they? So just in managing stress in itself will mean that we probably don't do some of the behaviors that kind of come about from feeling stressed. So that in itself is good.
Yeah, and I think, I always say probably the majority of the clients that I see when they are having their treatment will talk all the way through, because that's an outlet for them, and we're a sounding board. Now, I do have some counselling training, but most of our practitioners don't. But it is being able to listen effectively and hear that person, I think is a key part of what we do. But the other thing I will say is, in terms of reproductive reflexology, I always describe it as a patient-centered integrative approach. So what that actually means is that we use science to inform us of where the issues may lie, and in terms of then planning our treatment protocols. And we also use science to measure our outcomes. So, we use, I was talking earlier about using OvuSense to help us to understand what's happening for individual women in terms of the menstrual cycle, very accurate way of doing that. Or basal body temperature charting. And we also use that to measure the effects that reflexology is having. So, yeah.
So how does that work then? That you what is it? It shows that you can measure. So is it things like the cortisol levels where it's reducing stress, things like that?
No, what it actually does is it tells us exactly what's happening. So if we talk about menstrual cycle, for example, if you're using basal body temperature charting or OvuSense, which is measures either core or skin temperature, you can plot those temperatures on a graph, or OvuSense kind of takes care of it all for you and is much more accurate, actually, which is what's so exciting. And it tells us what's happening for that woman's individual cycle. So not only when is she ovulating, but how long is her luteal phase? Is there an issue with progesterone, which tends to get overlooked quite a lot? Is her luteal phase too short? Is she more at risk of maybe having a miscarriage? And it helps us in terms of our practice as reflexologists to determine what to do when. So, if you've got someone who's not ovulating regularly, it's going to make it very difficult to get pregnant. And so what we want to do is regulate the time of ovulation, and we've got a protocol that we use that does that, and we can then measure the effects by using charting.
Right. So you can make it much more specific to an individual person by doing that then, can't you?
Yeah, and that's the key, is that sadly, as we were saying earlier this morning, what we're taught in schools is really not very accurate, and most of us as men and women are relying on that, and so a lot of what we do when we're working with couples is educating them. Actually, this is what happens with your cycle. Or when we're working with men, actually, do you know what happens to your sperm and how they develop and how long that takes? And these are the different things that can impact upon them. So when we're working with men, we tend to rely on semen analysis to help us to determine where things are. And if we think things are not great, we'll quite often refer them on into medical practice or etc. And then we use that as our measuring tool. So
to work at what needs to be done. So you've talked quite a bit within that about how it can help with those that are struggling with infertility or struggling to get pregnant. How does it, other than the things you've sort of talked about there, how does it help? What would be the benefits of somebody coming to see you if they were struggling to get pregnant?
Okay, so if I just talk about men first of all, and this doesn't matter whether we're seeing individuals or whether we're seeing a couple or whether we're seeing a same-sex couple, we use a very similar process. So the first thing that we do is we want as much information as we possibly can. So our initial consultation probably lasts about an hour and a half, maybe longer, so that we can find out exactly what the issues may be for that specific individual or couple. And what we will then do is plan treatment with them. So we want to be able to measure that, and we want to be able to use very structured protocols. So for example, if we have a male and his count is low, and they're maybe not moving very well, and maybe they've been trying to conceive for 2 or 3 years, they may have had maybe an early miscarriage or otherwise, then the first thing we would do is refer them for a very robust semen analysis, probably with looking at sperm DNA fragmentation as well. And we would then treat them for 12 weeks. We have a specific protocol that we use, which is designed to work on both the endocrine and reproductive systems, so using these tiny little reflex points in the feet. And we quite often also set homework. So there are some really good points on the hands which people can manipulate themselves, which help to kind of speed up the process. And what that's designed to do is improve the quality and the quantity of the sperm. In the meantime, what we're also doing is managing stress levels. And the combination of those things means that usually when we then repeat a test 12 weeks later, we see better outcomes. And the aim is either that they go on to conceive naturally, or they're in a much better place to go through assisted conception.
Yeah, because their sperm production, whether that's quantity or quality, is much better than for whichever form they go through.
Yeah.
Oh, brilliant. I didn't realise it kind of was so in depth with that. And also it's great that if you can teach them some homework, that can help the process along as well.
Yeah. And I think the fascinating thing for us is that what we're doing is we're using science to measure outcomes. That's always the bit, I've been doing this for 30 years and it's, I still find it exciting. So, when if for example, you've got a woman who comes to see you, they're not ovulating. So we may get them, charting or using OvuSense, and you can see that there's no sign of ovulation. And then we'll start doing some work with them on a weekly basis, set them some homework to do, which works with endocrine and reproductive system, and then they ovulate. And then and then you start, I'm not saying it's a quick fix, but then you start to see the cycle getting back on track. Then they've got an increased chance of of conceiving naturally, rather than having to go through assisted conception, which is, it's a tricky path. It is a tricky path.
If you can help them before they need to get to that point, it could save them a lot of money in terms of treatment, but also the emotional and physical stress that they will go through going through it. And I think there's so many, I think when you're struggling to get pregnant, and I know myself how I felt, you're desperate to do something that will help. And I think having proven results as well, and it's something that can be monitored and analysed after, the benefits, and then those can be shown, it's a bit more guaranteed for people that they can see how it will help them, rather than some of the more untested things, supplements, things like that they might find online. This is a much more tested and proven thing they can go through to help them, isn't it?
Yeah, we did. We undertook a data collection study a few years ago. So we had just over 180 patients, so pieces of data, which in medical terms is not a huge number, but in complementary medical terms, it's very large, because complementary medicine, usually you'll get somewhere between 6 and 30 patients in a study. So for us to be able to gather data from that number was really quite something. And the first thing we did was we just put everybody in a big pot and said, what age are they? So they were aged between 23 and 46. They had just over 11 treatments as an average. And we had a % success rate, pregnancy success rate. So we were quite stunned by that, because our comparison really was, you know, couples who were singles who were going through IVF. So, you know, if you look at the accepted success rates for that, if you did a similar thing, you're talking about maybe 25 to 30% if you put that age group into a big pot. So that was really interesting. And then what we started to do was look at individual conditions. So look at things like pregnancy and live birth rates for endometriosis, polycystic ovarian syndrome, and of course we then started to see differences. But you know, all of the success rates were over 50%, and we were, you know, really quite stunned. And I am just in the process, because I'm doing a doctorate at the moment, so I'm just going back and revisiting all that data, which is fascinating. Fascinating. So yeah.
And really great to hear as well, that there are things people can do. So you've spoken there about men, about how it can help them, and about following these protocols, and how it can bring on it, or kind of regulate ovulation, help with things like endometriosis and PCOS. So if somebody so from the female side, they come to you, you'd look at any tests they've done, or talk to them about their cycles and things, and then would you have protocols to follow for them that would be specific manipulations then of certain points?
Yes, absolutely. So when we're working with women, the first thing that we do is look at any underlying conditions. And, you know, the first thing I always say is, we're not medically trained. So we're very clear about what our role is. And so if someone turns up with symptoms that have not been investigated, the first thing we do is send them back to see their doctor, because that's the place they should be. And also, we wouldn't want anything to be missed, and we certainly wouldn't want to be treating the wrong thing. And so we do have, once they've got a proper diagnosis, then we do have protocols that work for different conditions. But the key thing is the menstrual cycle. So we kind of split the menstrual cycle into 4 component parts. So we work during the bleed, and then from end of bleed to ovulation, when there's lots of activity. That during the follicular phase, we've got lots of follicle activity, both endocrine and reproductive. And then we work during the luteal phase, and we work to support implantation. So the key time we would work to support implantation, and then any possible pregnancy beyond that. So it's structured and designed to work with what is happening naturally. Or if clients are going through assisted conception, whether that's ovulation induction, or it's IUI or IVF, then what we then do is we use reflexology to support the drug protocols that they are undertaking. Yeah, we get rid of that bit and support whatever path they're on, really.
Yeah, so it's still safe to have it then whilst going through fertility treatment?
Yes, because what we're doing is we're taking a step back. We're saying the drugs need to take precedence, and all we're going to do is understand what those drugs are trying to achieve, and we're just going to gently support and reduce the risk of side effects. So we tend to find that if we get the opportunity to work with women before they start any treatment, then then what tends to happen is they go through their cycle more easily, and they experience less side effects, better outcomes.
Yeah, and like you said, there's always that chance that if you start early enough before treatment, that actually it could improve things so that you fall pregnant naturally rather than needing to go through the treatment as well.
Yeah, yeah, most definitely. We do quite often find that. And I think the other thing to say is that although what we're talking about is couples getting pregnant, the other thing is about supporting them in early pregnancy. Particularly, our focus is on those who are at increased risk of miscarriage. So we have a protocol that supports just in the early stages of pregnancy. It's very hands off. It's kind of about working in the background and not doing any direct work that would influence the uterus reflex point, for example. We tend to avoid that, but there are things we can do in the background that will support women in early pregnancy if that's a risk.
Is that things, so what sort of things would that be doing then, working to sort of reducing stress levels, but also the kind of other stimulating other hormones, is it, or how would
so
that?
in the main, for women, it would be supporting their progesterone levels. So for us specifically, the place that we focus is working on the ovary reflex point, both in the hands and the feet, because at this point what you've got is a corpus luteum that's formed in the follicle that released the ovum, and that corpus luteum is secreting progesterone. And so sometimes if you've got someone who's had poor egg quality, or for example women with PCOS who can have quite unstable progesterone, then what we do is we try and stabilize that so it reduces their risk of having a miscarriage. So we're very much focused on progesterone at that stage.
It's really good to know that, because I speak to a lot of women who have had previous miscarriages and are scared going into IVF or even falling pregnant naturally. They don't feel that they get much support, and they don't really know what else they could do to stop it happening again. It feels very much out of their hands if they've done everything they can before. So it's interesting to know that reflexology is something that could support them through that as well, if they're worried about having another miscarriage, and think action they could take to help improve the chances of a live birth.
I think also the other thing to say there is this is where the men come in. So we know that men are involved in 50, maybe 60% of all cases where there's difficulties conceiving, but also are involved in repeat miscarriage. So if we've got a couple that come to see us who have had a miscarriage or two, the first thing we will do is send him off to get some decent sperm DNA fragmentation testing. Because it's overlooked. Yeah, it just gets overlooked, sadly. And quite often there's quite a lot that can be done about it. And the problem you have there is that unless you address that issue, they can go and have as much IVF as they like. It's not going to fix the problem.
Yeah, and that's something that needs to be understood earlier, doesn't it? Many women probably think, well, I'll come once I get pregnant to help me keep the baby, but actually that work needs to be done much earlier, doesn't it? So there needs to be an awareness around that, really, about how it impacts.
Yeah, it has changed. And last year now, 2021, the World Health Organization released their new document on assessing, measuring semen analysis. And they have changed their recommendations in terms of sperm DNA fragmentation. Whereas it was always seen as really experimental, it's now become much more mainstream, and there is a recognition that it does have a role to play in terms of fertility and miscarriage. And it's, we've been talking about it for 10 years. So now to see that happen is fantastic. So yeah.
That's good, because there'll be much more encouragement then from doctors, from fertility consultants, to have that information to hand, to have those tests, won't it? And find out, because as I say, it's almost seen as, until you've had multiple miscarriages, things don't always get looked at, and a lot of people I speak to really struggle with that. So I think, knowing different ways to focus on that is really good.
Yeah,
Um,
most definitely.
so there's a lot of benefits there to having reflexology. Is there anything we haven't covered within that? I mean, feels like there's so many different things it can help with.
I think there is, and I think that a lot of the work that we do really is about just letting people know that reflexology is a useful modality as part of their journey. And when I say patient-centered approach, I always, when I'm teaching, I say patient in the middle, and reflexology is just one plug-in, and it forms a part, because that's the important thing, is that that particular individual feels that they get what they need to move them forward on their journey, to becoming a parent, because we're all individuals, we're all different things will work for different people. And I think really it's just, actually reflexology does have a place, it does have a role. It is this particular form of reflexology is very science-based. So we train our practitioners to a high standard, and they are expected to keep their skills up to date. So I was talking earlier about Ovusense. Rob Milnes from Ovusense came to speak to us. So that is a lecture that is then available for all of our practitioners. We have gynecologists speak for us, professors of reproductive medicine, fertility nurses. We have a really robust continuing professional development program for our practitioners, so that they're being exposed to as much as we can, the latest pieces of information that coming through in reproductive medicine.
And that's also good from a point of view, because it's very much a listening therapy as well. And what you were saying before, and I know when I've spoken to other holistic therapists, they feel very much like that. I think it's that non-judgmental person that you feel you can talk to, that time out where you are having treatment, but also you can speak to them because they treat a lot of other people who are in similar situations. So by having that continuous development, when they're talking to patients as well, they'll be more knowledgeable on things to maybe that they can research, other people they can speak to, things to consider, which is really good, isn't it?
Yeah, most definitely. I mean, I think, as you said, we are a good listening ear. And one of the things that we do positively encourage our practitioners to do is refer patients into medical practice if they feel there's been something that's been missed. And so it's really important that we have practitioners who have the understanding and the skill to be able to listen to that person's individual journey and flag up if there is something that they think has been overlooked, because it can sometimes be something really small that can be easily remedied, and no one's actually focused on it. So
or also they haven't maybe brought it up when they've been speaking to their consultants. A lot of people say, well, I forgot when I was in the meetings because I was so overwhelmed, or even just feeling that they won't understand. Whereas when they're in a much more relaxed and feel safer emotionally, they're much more likely to open up and talk about things that they're struggling with, aren't they?
Yeah, most definitely. I think that's exactly what happens. And also, particularly if you're being given difficult news, what happens is you shut down, and then you can't hear what's being said. And if you can't hear, then you forget to ask. And so, yeah, so sometimes when they come with, you may find that the first session, it's, here it comes, this is all the stuff that's been going on. And then gradually over a period of time, we start to be able to, it's like doing a jigsaw puzzle. You start putting all the pieces of the jigsaw puzzle together and go, maybe that's a bit that hasn't actually been addressed yet. So yeah,
and you can look into that. I think it's amazing. It's really interesting for me to hear more about it, because I wasn't aware, and it's great having that, because like you say, it's important to have different things that are right for different people, different support resources, different ways of helping. If say acupuncture isn't for you, reflexology might be. I mean, I don't like needles. So for me, that would have never been an option. So I think it's important to have lots of different things that then people have a choice of, don't they?
Most definitely. And I think also the thing to say there is acupuncture and reflexology work very well alongside each other.
Mhm.
So you probably wouldn't want to have them within about 24, 48 hours of each other, but there's no reason why you can't run them alongside each other. Or if you're, seeing a herbalist, or you're seeing a homeopath, or you're seeing some other. What I usually say to my practitioners is, with patient permission, make contact with the practitioner so that you're working collaboratively to support that patient.
Yeah, so you're not doing things that could contradict what each other are doing or cause problems that way.
Yeah.
And it's interesting to know that they can be done alongside each other, just allowing for that time difference between appointments as well.
Yeah, and I think that's also about making sure that individual patient gets exactly what they need, that it is completely tailored to them.
Yeah. So that's brilliant. Thank you so much. How can people find reflexologists? Where can they find somebody that's reputable, or get in touch with you or people you work with, just so that they know they're with somebody who is safe and reputable, really?
Okay, so in terms of finding a practitioner there near them, we have a Find a Practitioner on our website, which is just reproductivereflexologists.org. So if you just go to that, then you'll find that. If they want to find me, my website is Seren, S for sugar, EREN. So Seren, it's a Welsh word which means star, and is also the name of the Welsh fertility goddess. So I kind of nabbed that, but also because I think all of the little babies that arrive are like little twinkling stars in their own right. Really, it's just special. So serennaturalfertility.co.uk is my website where you can get hold of me. Or if you want to contact me directly, the most direct email address is just Barbara, so BARBARA .serentraining@gmail.com.
Okay, I'll put all the information when I share the video. I'll put all the information for everybody so that you can access all the links for that as well. And it's great if there's a Find a Practitioner part on the website as well, so people can find people local to them as well.
Yeah, and if they get stuck and can't find anyone, because not all of our practitioners are very good technology wise, and so they don't put their details on the website, and then we end up scrabbling around, because we do have practitioners in the UK, in Ireland, in some European countries, in Australia, in Canada, and I'm just going out to teach in New Zealand later in the year as well. So they are all over the place. So, but they're not all on the website. So if anyone gets stuck, just drop me an email, I'll do what I can.
And you can point them in the direction. Oh, brilliant. Thank you. So just to finish off, is there anything else you'd like to sort of say about reflexology as a final point about benefits or how it can help people?
I think we've probably covered most of it, other than to say, if it is something you want to try, if you're looking for someone, I always say, and you're not sure, ring up, have a chat, or maybe find, you can go onto the website and maybe find 2 or 3 of our practitioners and have a chat with them, and see who you feel comfortable, working with.
Yeah.
What I would say is, if you're looking for a reflexologist, do make sure that they've had some robust training, because sadly there are some that just put fertility and they've not got any training behind them, and you need someone who knows how to look after you. So, but it's also really important to find someone you can work with. So have a chat with them first of all before you go and see someone. That's the key thing.
Oh, thank you so much. That's really great advice. And it's been brilliant, really interesting to find out more about you and about reflexology and how it can help people. So thank you so much for your time.
Pleasure, Sarah. Absolute pleasure.
Thank you.